Ringing ears, or tinnitus, as some people call it, may be a sign of a very serious condition or an underlying disease that requires treatment. Hello, my wonderful viewers and returning subscribers. You're most welcome to my YouTube channel, Dr. Winnie the Pharmacist English version, where I discuss all things health. I also have this channel in Pidgin English too, for those who do not understand English very well or who prefer Pidgin English, because sometimes Pidgin English sticks better when it's used to pass information, especially for West Africans. That said, my name is Dr. Winnie. I'm a board-certified pharmacist and a practicing herbalist. From the topic you have seen on the screen today, I'll be looking at tinnitus or tinnitus, which means ringing ears. Tinnitus is spelled Tinnitus. I prefer to call it tinnitus, so I don't know what you call it. I'll be swinging in this video from ringing ears. You'll be hearing tinnitus also, or tinnitus. So I don't know what you watching me from your own end call it. Whatever you call it, kindly put down your comments in the comment section. Thank you. Like I said, we will create awareness about tinnitus or ringing ears. We will be spreading knowledge and support to those who have it. We will also look at the link between tinnitus and diseases and what you need to know. We would also, in this video, be looking at common causes of tinnitus. In other words, we shall unveil the common causes of tinnitus and decode the mystery behind tinnitus or ringing ears. Firstly, what is tinnitus? Tinnitus is the medical name for hearing noises in the ears. That's just the simple meaning of tinnitus. And the funniest thing about tinnitus is that everybody, or almost everybody, let me put it that way, at one point or the other of their lives have had tinnitus, including myself. If you're watching this video right now and you've ever heard noises or ringing in your ears, please kindly indicate in the comment section. The funniest thing about tinnitus is that it occurs when there is no outside source of sounds or noise. So it just occurs. There may not be noise anywhere or in the environment around you or in the environment around the person who hears the noises or feels the ringing in the ear, but the person will still be hearing noises or ringing in the ears. Tinnitus fills one's ears with sounds that no one else hears apart from the person who is experiencing it, and it affects millions of people in the world. In fact, tinnitus is a very common problem. It can be severe, affecting people's daily lives. Tinnitus itself is not a disease, but it is a symptom of several medical conditions. Now, I'd like to let you know that healthcare providers cannot cure tinnitus, including myself because I'm a healthcare provider. Healthcare providers cannot cure tinnitus, but they can help one to manage its impact. If one has tinnitus, one's head is filled with sounds which no one hears, and these sounds can range from clicking sounds, ringing sounds, to whistling sounds. You know how whistling sound looks like? So clicking, like the clicking of glasses. Whistling sounds, roaring sounds even. You know roaring sounds, like the sound of a lion. Wow. Imagine your ear roaring like that of a lion, or hearing a roaring sound in your ear. Buzzing sound like that of a bee. Hissing sounds, humming sounds. Humming, like when someone sings and sizzling sounds. I don't know whether you know what a sizzling sound is. Sometimes when you want to fry something and then you put it inside the frying pan, and then the sound it makes when the butter is dissolving into the hot frying pan is a sizzling sound. So sometimes you can hear that in the ears. Please, It should be noted that tinnitus may be so soft, that's the sound in the ear, may be so soft that one may not notice them, or may be so loud inside the ear that the person who is hearing them or feeling it may not even hear any external sound. It may be so loud and so disturbing that the person who feels it may not hear any external sound. Maybe if you're talking to the person, may not even hear because the sound is so loud that it blocks off any external sound. That's how bad tinnitus can get sometimes. A person having tinnitus may think that they are hearing air escaping or water running in a seashell, or 3. Musical notes. Sometimes tinnitus may last for a few minutes, while sometimes it may also last for a longer while. Constant and recurring tinnitus may be stressful and may make it harder to focus, concentrate, and sleep. Living with tinnitus can make people angry, frustrated, and depressed because it disrupts their daily lives. There are 2 ways to describe tinnitus, or there are 2 types of tinnitus, namely objective and secondly subjective tinnitus. So let's look at the 2 of them and what each of them mean. Subjective tinnitus means that the sound is only heard by the affected person, while objective tinnitus means that the sound is heard by both the affected person and the examiner. When the examiner uses a stethoscope near the ears, the head, or the neck of the affected person. Before I go on, let's do a little analogy. Tinnitus is a very important topic to discuss, and there's a lot of things that could precipitate or cause tinnitus, or there's a lot of reasons why people may be having tinnitus. So most times tinnitus is not to be ignored, because tinnitus can be a sign that there is a serious illness, or there's a serious underlying illness that someone has. It's just like, let me use this analogy. Some of us drive cars. Now, most times cars give people symptoms and signs that there's a potential or imminent danger ahead, but many a time most people ignore these signs until their cars pack up. The same thing is with tinnitus. Most times when one has tinnitus, it's a sign or symptom that there's an underlying disease or there's an underlying serious condition that needs to be attended to quickly. However, most people will ignore it, and when they ignore it, eventually they fall into more serious troubles because they have not tackled the underlying conditions, and then with time those underlying conditions keep building up and then cause complications which could lead to death eventually. For instance, since I'm using the analogy of a motor car here, let's say one's engine oil is leaking. Maybe that's the tinnitus for the car right now. The engine oil is leaking and the owner of the car does not do anything about it, and the engine oil keeps leaking from under the car and dropping on the ground. Of course, eventually, cumulatively, that engine oil, if it continues leaking without being attended to, the engine oil will leak all out and the engine will be empty, so there will be no more oil. And then the owner of the car, who has been ignoring that sign, instead of refilling the engine oil or taking it to the mechanic so that he or she can know what is the cause of the leaking engine oil and fix it, probably maybe 1 or 2 or 3 of the oil seals may be damaged or may be worn out or have spoiled. They won't do it, so they leave it, and then the engine oil finishes and the person keeps driving the car as usual. What will happen to that car? Definitely, if the person drives the car when the engine oil is finished or has leaked all out, the engine will definitely knock if the owner of the car drives that car without any drop of engine oil in it. That's the same thing that occurs in the human body. The human body is so dynamic and so wonderful. God has created the human body in a very wonderful way as to give us signs and symptoms that, okay, something is about to happen. There's something causing this or something that is going wrong with the body. But most times people ignore, and when they ignore, then eventually they get into more trouble because they get a lot of complications which they can no more handle. Most times it's always good to nip the problem at the bud. What I mean by nipping the problem at the bud is as soon as the problem begins, you just hit it immediately and stop it right there, end it there. But most people don't do that, and that's the essence of this channel, to educate people, to bring knowledge to people, so that when one has heard about this, probably through Dr. Winnie's channel, that okay, this is that, I've heard this kind of thing and this is what is happening to me, then one can take precautions. Because I believe that if one takes precautions on time, then one can avert a lot of dangers or imminent dangers. So let's move to the next agenda on this topic, still on tinnitus. Tinnitus is linked to more than 200 health conditions, but for the sake of this video we shall be looking at the common ones. One may develop tinnitus if any of the following occur, namely: 1, you are developing hearing loss. So if someone is developing hearing loss, one may have tinnitus, to warn the person. And I'd like you to also know that hearing loss may be age-related. Another name for age-related hearing loss is presbycusis. Please look out for the spelling on the screen. 1 in 3 adults over the age of 65 have presbycusis, that is age-related hearing loss. 2, head injury. 3, ear infection. 4, hypertension or high BP. 5, aneurysm. What is an aneurysm? Let's look at it. An aneurysm is a localized swelling or a weak expanded part of an artery, like a bulge in a balloon. So look at it. Of the walls of an artery. You know, an artery is meant to be like siphon shaped, like a pipe. But this time around is a localized swelling. So in the part of the pipe there is a swelling like a balloon. Now we're going to demonstrate it here. So if not attended to, an aneurysm can burst. It can rupture and burst. And when an aneurysm bursts or ruptures, it causes internal bleeding, and this can lead to death. So let's practicalize what aneurysm is. Now look at, let's say this is the artery. Just imagine it, that this is the artery. This side from here to here looks more like artery shaped because it looks like a pipe, while this bulge here looks like the aneurysm. So you know, inside the artery there's blood. Arteries transport blood. Now imagine the artery is bulged. Let's bulge it up. So now the artery that is meant to have the shape of a pipe is now bulging like a balloon. There's blood inside. And can you remember when you were small? Because when I was a little baby or a child, like in the age range of 1 to 5, I loved balloons very well. And so I used to beg my parents to buy me balloons. And when they buy us balloons as children, we'll blow it and blow it. But we didn't really used to know the limit. So we just keep blowing it. Last time, this is an aneurysm. You can imagine most of the people here watching me are adults. So if you keep blowing this balloon and it keeps bulging, what will happen? The next thing you hear, pa, and it will burst. Mind you, this aneurysm, that's what we're using as aneurysm now, is a bulged artery that has blood inside. So if this one bursts, you know, the artery is inside the body, it will now burst. Of course, the blood that is inside will just splash into the body, and then one has internal bleeding. So you can see tinnitus sometimes develops because someone has an aneurysm. Therefore, if one has tinnitus or ringing in the ears, one should, the best advice I'll give to that person is to quickly go for a medical checkup and check one after the other all these things that I'm saying, that all these parameters are not there. Because one could be, oh, my ear is ringing, my ear is ringing, my ear is ringing. Meanwhile, it's a sign that they has aneurysm. And because he's just taking the ringing for granted, after all, it happens, I don't know. Meanwhile, something is happening right inside the body. If it is an aneurysm, it's dangerous, because if it eventually bursts, which it will eventually do if unattended to, then there will be internal bleeding and somebody will die. That's why you have some people just sit down, all of a sudden they say, they died of internal bleeding without an accident, without anything. So we should be careful. Thank you. 6, an allergy. So tinnitus can be a sign that someone is allergic to something. 7, a tumor. Tinnitus can also be a sign that there is a tumor in a part of the body. 8, temporomandibular joint disorder, TMJ. That's the spelling on the screen right there. What's TMJ? TMJ is a group of more than 30 conditions that cause pains and dysfunction, inflammation and irritation in the jaw joints and muscles that control the jaw movement. 9, diabetes. 10, obesity, that's excess weight. So tinnitus can be a sign of diabetes. It could also be a symptom of obesity or excess weight. 10, thyroid problems. 12, tinnitus can be a sign or symptom that one is exposed to loud noises or explosions. This could also be a reason why military veterans have tinnitus or ringing in the ears. 13, if one is exposed to very loud music or working in a very noisy environment, one could have tinnitus or develop hearing loss. 14, ototoxic medication or ototoxic drugs. Ototoxic medication or ototoxic drugs can cause tinnitus or tinnitus, however you call it. So let's look at what ototoxic drugs or ototoxic medications are before I list the examples of ototoxic drugs. So what is ototoxic, or what does ototoxic mean? When we say that something is ototoxic, especially a medication, or when you hear the word ototoxicity, because the two go hand in hand, they are the same thing, ototoxic or ototoxicity, it simply means that that drug has the tendency to damage the hearing or balance organ. And what is the hearing organ in the body? It's the ears. So when you hear me say ototoxic or ototoxicity or an ototoxic medication, it simply means that that drug is dangerous to the ear. It can damage the ear, the inner ear, therefore causing deafness. So if something damages the ear, of course, definitely it will affect one's hearing and one's balance, because the ear is responsible for hearing and balance. Did you get it? So without any further waste of time, I'll simply give you a list of few examples. There are several examples actually of ototoxic drugs, but for the sake of this video, let's look at a few examples. The number one example, or the first on my list, is a group of antibiotics called aminoglycosides. You know, antibiotics have different classes. So there's this class of antibiotics they call aminoglycosides. They are useful as antibiotics, that's to fight off bacteria and to kill off bacteria. But on the other hand, if not well utilized or supervised by a qualified healthcare provider, they could become ototoxic, especially when used in higher doses than normal. So what are examples of aminoglycoside antibiotics? I'm sure you've heard about gentamicin before, or gentamicin, anyhow you pronounce it. Gentamicin injections are very common. So we have gentamicin, we have streptomycin, we have neomycin, we have kanamycin, we have amikacin. All these sin drugs, they are all examples of aminoglycoside antibiotics, and they're actually ototoxic. We also have other antibiotics on the list like vancomycin, netilmycin, tobramycin, and so on. The second group of ototoxic medication or ototoxic drugs on our list today will be anti-cancer or chemotherapy drugs or chemotherapeutic drugs, any way you call it. And a good example or some examples of such ototoxic chemotherapeutic drugs include cisplatin, carboplastin, etc. The third group of ototoxic drugs or medications that could cause tinnitus is the loop diuretics. Now we have several types of diuretics. What is diuretic, or what does a diuretic mean in the first place? A diuretic is a drug that helps one to remove excess salt and fluids out of the body. So most often, people who use diuretics are usually the hypertensive patients. Use diuretics a lot, so to help them to push out excess fluid and excess salt out of the body. And we have different classes of diuretics. So you see that someone who takes a diuretic drug always urinates very often, frequently, so that the fluids can pass out of the body, the excess fluids can leave the body. Now, I am not saying that it's all diuretics that could be ototoxic, but today we are more concerned or very particular about the diuretics called the loop diuretics. Let me give you some examples. Examples of loop diuretics include furosemide or furosemide. That's the name of the drug. A very common brand of furosemide is Laxis. We also have torsemide, and so on and so forth. The fourth example of ototoxic drugs is quinine. I know that quinine is very common. It's a drug used for treating malaria. It's an anti-malaria, but it could be ototoxic. Therefore, it could damage the ears and could cause tinnitus. And the last on my list for the examples of ototoxic drug is The salicylates. A very good example is aspirin. So you see, people should be very careful with aspirin. We have different types of aspirin in the market. We have the low dose aspirin and the high dose aspirin. The high dose aspirin is usually used for treating aches and pains, like those of 300 milligram, while the low dose aspirin is usually administered, I think it's about 75 milligram dosage strength. The tablets is usually administered to hypertensive patients or people who are prone to hypertension in order to reduce platelet aggregation. Let's not make this video too medical, like let's not put in a lot of medical jargons, but I just want you to know that aspirin is ototoxic, and so people should be careful with it. You don't just say, oh, I feel pain, and the next thing, because your doctor prescribed aspirin to you one long time ago, then you jump on it and begin to take it. No, I would advise you that before you even take any drug at all, you should consult with your healthcare provider. You should ask questions, whether it be simple over-the-counter medications, over-the-counter drugs, or prescription medications, like you've seen in my other videos. Even supplements and over-the-counter drugs can cause a lot of damage. If you look at my video, when I was talking about vitamin A and the damages it could cause, and vitamin A supplements and different other types of supplements, then you'll understand what I'm saying. I'd also like you to note that apart from ototoxic medications, that there are ototoxic environmental substances. When one is exposed to environmental substances like mercury, carbon monoxide, tin, and lead for over a long period of time or a chronic period, meaning the same thing, one can develop tinnitus and hearing loss with time, because these substances are ototoxic. So this poses as a warning to tin miners. We have a lot of tin miners here, and they inhale all these things. They are very exposed to them. One should be careful, because exposure to these things, or even inhalation of carbon monoxide and the other substances that I have even talked about, being exposed to them over long periods of time, could lead to hearing loss and could cause one to develop tinnitus. So I'd advise people to be guided. One could also develop tinnitus if one has Meniere's disease. So what I'm saying here in essence is that tinnitus may be a sign that one has Meniere's disease. Now, what is Meniere's disease? Please look out for the spelling on the screen and also the definition, but I'll say it here too. So what's Meniere's disease? Meniere's disease is a chronic ear disorder that affects one's balance and hearing. Tinnitus could also be a sign that there are foreign objects in the ear. So something may be inside somebody's ear, or something must have fallen into somebody's ear, maybe an insect or a pin or any object at all. So that could also, when someone's having ringing in his ear, they should check. Maybe accidentally something may have crawled into the ear or things like that. The 16th cause of tinnitus is excess earwax, or what we call cerumen. Look at the spelling up there. Excess earwax in the ear can block one's ears and affect one's hearing. Likewise, foreign objects in the ear too can do the same thing. The 17th cause of tinnitus is allergies. Now, allergies that affect the eustachian tube or eustachian tube. Spelling on the screen as usual. Now, the eustachian tube actually connects the middle of the ear and the back of the nose. Do you also know that tinnitus can be a sign of anemia? That is, anemia simply means blood loss, or when somebody's blood cells are fewer, and anemia can be caused by quite a number of things. Do you remember my video when I talked about low blood pressure? Please, I'd like you to go and look at that video again. So sometimes when your ear is ringing, it could simply be telling you that, oh, your body does not have enough blood. And if your body does not have enough blood, several things could develop. Low blood pressure. If low blood pressure develops, you know what it means. It could cause brain damage. It could cause quite a number of things. It could cause stroke. That ringing in your ears or in one's ears that you have been ignoring for a while, please, my candid advice to you as a qualified pharmacist and your healthcare provider is to please go to the nearest healthcare provider, go see a doctor, run tests, tell the doctor about what you notice, then run tests and check these parameters which I have been talking about throughout this video, and make sure that they are not there. Please. Tinnitus can also be a sign of head injury. Yes, if someone has had an accident before and then has injured his or her head, so check your head that everything is intact and there are no complications, or yes, complications that have developed, please. These are all signs. So you can see that God is wonderful, because these are the reasons why some people are just walking on the road and then one day they just drop dead. Then they say, I didn't know, there was no sign, he was healthy, she was healthy. But no, the body was actually giving them signs, but they were ignoring it, or they didn't understand. So you see, ignorance is not an excuse. I think the Nigerian police used to use that phrase a lot. They say ignorance is not an excuse. Well, I don't know for their own context, but medically, I would agree with that. You're now hearing it from Dr. Winnie, the pharmacist. Please quickly rush to your doctor. Check, so that you don't get into a bad situation, or it doesn't get late. It doesn't get to a stage where simple things can no longer be handled, and before you know it, you just hear that one slept and he died, or one was walking and he fell down. We don't want to hear that. Thank you. 20. Tinnitus can be a sign of autosclerosis. So when one has autosclerosis, one could also develop tinnitus. Now, what is autosclerosis? Simple. Autosclerosis is a growth in one's middle ear, the middle ear. 21. Tinnitus could also be a problem with the eustachian tube that runs between the middle of the ears and the throat. So you can now see that, from what I'm saying even, that the ears, the nose, and the throat are interconnected. That's why the doctors who specialize in treating the ears are called ear, nose, and throat doctors, or otorhinolaryngologists. So you can see that tinnitus has a lot to do with the ears, the stability of the ears and the health of the ears. So I'd also advise you to check with the ear, nose, and throat doctor. That's ENT doctor, or otorhinolaryngologist. Spelling up there. Thank you. 21. Tinnitus could also be a sign or symptom of vestibular schwannoma. Spelling up there. In other words, an acoustic neuroma. Now, what is a schwannoma? A schwannoma is simply a tumor that develops from the Schwann cells in the peripheral nervous system or nerve roots. Schwannomas are always benign and slow growing What does it mean when we say a tumor is benign? A benign tumor is a tumor that stays in their primary location without invading other sites of the body. They do not spread locally or to distant sites of the body. Let's say, I'm just using this as an illustration. We have a tumor here on this part of the nose and it's benign. It will just stay here and grow here. And benign tumors usually grow slowly. It won't start spreading everywhere, spreading around, around, or metastasizing like the malignant tumors do. So like I said, benign tumors do not spread locally or to distant parts of the body. That's the meaning of that explanation I just gave now. They grow slowly and have distinct borders, whereas unlike the malignant tumors, which is the direct opposite of the benign tumors, those ones, they actually kill because they are metastatic. What do I mean when I say they are metastatic? I mean that they grow uncontrollably and spread locally to distant body sites or distant parts of the body, like I just explained using my nose. When I said if a tumor is growing here and then it begins to spread, before you know it, spread into the brain, the mouth, everywhere. And that's why malignant tumors kill. So vestibular schwannoma forms in a nerve in one's inner ear. Now, a very, very important note I'd like you to take note of this. Alcohol, caffeine, or smoking may worsen tinnitus if one already has it. So if one has tinnitus, what I mean by this is that if one has tinnitus, which can be a sign of all these parameters that I have already listed, or I have been listing since the beginning of this video up until this point, and one takes alcohol and indulges in smoking and also takes caffeinated drinks, it could worsen tinnitus. It means that the tinnitus, the ringing in the ear, can become more, So if you notice in most of my videos, I've always talked about alcohol. Alcohol, and I'm going to say it again, it actually does you no good. So you're hearing it from the horse's mouth again. This is the umpteenth time I'm saying it, that alcohol does you no good. It's a lot better or more beneficial to stay away from alcohol, because alcohol has been implicated in a lot of things. When I was talking about low blood pressure, I talked about alcohol. Today, I'm talking about tinnitus or ringing in the ear, and you can see that alcohol has resurfaced again. So be guided. Now, sometimes some people say that alcohol is important for the heart because red wine is good for the heart. Yes, every wine contains alcohol. That's true. I'm talking about drinking beer here and there and alcoholic drinks here and there, making it a habit, forming it a habit, drinking here and there and here and there and here and there. Let me tell you, everybody takes alcohol, including myself. I'll tell you why. Every fermented food has alcohol. You cannot have a food that is fermented that does not have alcohol, because alcohol is a byproduct of fermentation. So you already, as a human being, have enough alcohol in your food by way of eating fermented foods. We wouldn't want to go into that, so that we don't delve into another thing. We are talking about tinnitus. Alcohol just resurfaced, and I decided to re-emphasize it again. Children can also be affected. So that means that children can also have tinnitus or tinnitus, especially those with severe hearing loss. So if your child is having ringing ears or tinnitus, it means that the child is developing or has severe hearing loss. Now, tinnitus or tinnitus may also be a sign of pulsatile tinnitus. What is pulsatile tinnitus? Let's look at it. Pulsatile tinnitus rarely happens but occurs when blood rushes through the major arteries or veins of one's neck. Pulsatile tinnitus is a rhythmic noise that follows a steady beat. It involves sounds timed to one's pulse. Let's look at things that could cause pulsatile tinnitus or tinnitus. So 1, we have anemia. But I've already said before that anemia could cause tinnitus. So if somebody has tinnitus or tinnitus, it could be as a result, or it could be a sign that the body is warning one that he or she has anemia. The next one is atherosclerosis. I'm sure you've heard of the word atherosclerosis before. That is blocked arteries. I think we'll do a separate video on atherosclerosis, but you can now see that tinnitus, tinnitus. So if your ear is ringing, don't take it that, oh, my ancestors are calling me or somebody is talking about me somewhere. No. This is a sign or a symptom that God has put in place to warn you of imminent dangers in your body. Now, the third cause of pulsatile tinnitus is high blood pressure or hypertension. We shall also look at this in another video. So, with these few points of mine, you can see that the tinnitus or the ringing in your ears is not an ordinary thing. Most of the time, it's not ordinary. It's a signal. It's a warning that Mr. A or Mr. X, please do something. The body is malfunctioning. The body system is malfunctioning somewhere. I talked about aneurysm. I've talked about several things that tinnitus could be a result of. So please look at it very well. If you cannot remember, please kindly scroll back this video. You're allowed. It's free of charge. Scroll back this video, pause it, and listen to it again. And please, I'd advise you to go to your doctor or qualified healthcare provider and run some tests. Tell them what you feel, what you experience, what you may be suspecting based on the parameters that I have highlighted in this video, so that they'll check for you, so that you can live a longer, better, and healthier life.